Hello, welcome. Welcome to our program today on behalf of Plano Public Library. We're happy to have you with us, and we are happy to have a volunteer with us today, or actually the benefits counselor with the Area Agency on Aging, who's going to talk to us today about Senior Medicare Patrol. Your mics have been muted, and you may certainly offer questions or comments in the chat, and we will ask Mary Jane the questions as we go along or at the end, depending on where the question makes sense. And there will also be some handouts and things at the end that she'll share with us, so that if you would like further information, you can request your own copy of these handouts. We're using chat again to ask questions, and you are muted. I'm sharing screen right now, and we are about to begin the presentation with our presenter. Mary Jane, thanks so much for being with us. Today we have Mary Jane Frank with the Area Agency on Aging. She's a benefits counselor and knows all kinds of things about Medicare and the benefits and other resources for
like the Senior Medicare Patrol.
Exactly, resources that you may benefit from. And so that's why we're doing the Senior Medicare Patrol today. And so Mary Jane is going to talk with you about these this program and resources. And I am going to stop sharing this screen and start the other screen for your slideshow, Mary Jane. So thank you to Mary Jane for being with us. And
all right. Thanks, Kristen. Okay, so she's getting ready to share my screen. I am Mary Jane Frank. I'm with the Area Agency on Aging, and I'm a benefits counselor. So I help people with Medicare and Medicaid. My clientele is 60 and above, or if you're under the age of 60, you're on disability and Medicare. So I'm a full-time staff benefits counselor for the Area Agency on Aging. I am a volunteer for the Texas Senior Medicare Patrol. And so I want to talk to you today about information about this program and how to prevent Medicare waste, fraud, and abuse. So if you'll change slides. Next slide, please. So what is the Senior Medicare Patrol? Well, it is funded by the ACL, which is Administration for Community Living. And we recruit and train volunteers and professionals about Medicare fraud and abuse. There is a Texas Senior Medicare Patrol hotline to report any Medicare if you think it's an error or fraud or abuse. And it's the 1-800 number, and it's available to all 254 counties in the state of Texas. And so what happens is when you report something to the Senior Medicare Patrol, that staff will gather your information and decide whether it's a possible fraud or abuse. And then they will further that information onto the appropriate agency, whether it be the Attorney General, Department of Justice, or the Officer of Inspector General, and they will build the case and prosecute. So we just kind of do, or the Texas Senior Medicare Patrol just kind of does the basic foundation work and try to decide whether they really think it's fraud or abuse. And there is a Senior Medicare Patrol in every state. Next slide. So why is Medicare such an easy target? Well, that's easy. Medicare processes 5.4 million claims per working day to 1.5 million vendors or providers. They have they are required to, and CMS means Center for Medicaid and Medicare Services, they're required to pay the claims within 30 days. And so there's really no documentation required unless it's investigated. So as long as it has the proper code, the billing code, then Medicare just goes on and pays it. And because there's so many claims made every day, they can only review about 3% of the claims that are submitted. So it's very easy to get away with Medicare fraud. In fact, They have something called the Medicare Mafia. And now the mafia is getting into Medicare fraud because it's so much easier to make money than in the drug market. So it's less dangerous. All right, next slide, please. So these are the 3 steps in preventing Medicare fraud, waste, and abuse: protect, detect, and report. And we're kind of going to go over those 3 steps. Next slide, please. So these are kind of some do's and don'ts to protect yourself from Medicare fraud and abuse. So you really need to treat your Medicare card and your number like a credit card, because if someone, unsavory gets a hold of your Medicare number, they can do a lot of damage and they can bill a lot of money to Medicare and make a lot of money in Medicare fraud. And do be aware that Medicare is never going to call you or visit you to sell you anything. The only time Medicare might call you is if you have a complicated issue with Medicare and they have referred you to, they call it advanced resolution, and they will assign a day and a time that someone will call you back. But normally Medicare does not call you back. And some of the don'ts: don't give your Medicare number except to your doctor or any other Medicare provider. I know I'm a benefits counselor and I do need to ask for your Medicare number, but most people that contact me, they have instigated the call, or initiated the call, I should say. So, so I would have to ask that information from you. And don't carry your Medicare card with you unless you have a doctor's appointment or something that you know. Maybe you're going to a health fair and they're giving out flu shots. In that respect, yes, they do need your Medicare number because they have to bill Medicare for the flu shot. But don't just carry it around with you because you think you might have an emergency. And don't carry your Social Security card around with you either, because if somebody steals your wallet and they get your driver's license and your Medicare card and your Social Security number, they've got a ticket to paradise, because if they start using that information illegally, they can make a lot of money and make your life miserable. Next slide, please. So the step 1, protect yourself from healthcare scams. So these are just some examples of healthcare scams. It might include maybe someone fraudulently uses a physician's identity or steals a physician's identity to medically certify that you need supplies and start billing Medicare with a fraudulent physician's signature. Maybe someone might steal your Medicare number and use it to bill Medicare for durable medical equipment that you don't need or that you never even received. Don't let anyone offer you food or a meal in exchange for your Medicare number. If someone calls you or visits you in your home and they're going to offer you free equipment and all you need to do is give them your Medicare number, don't do it. Nothing is ever free. Maybe a durable medical equipment supplier might bill Medicare for example, they might bill Medicare for a power wheelchair, and then the only thing that you get is a manual wheelchair. So that's another way, that's another big healthcare scam. All right, next slide, please. So step number 2, you want to detect Medicare fraud and abuse. And there's 3 different ways we can do that. We're going to talk about a personal health care journal, and then we're going to talk about Medicare summary notices, and then also establishing an account on mymedicare.gov. So next slide, please. So this is a personal health care journal, and I actually have one here with me today. It's about the size of a typing sheet of paper that's folded into thirds. And if you want me to mail you one of these, I'll be happy to do so. My information is at the end of this slide, and I think they're going to type my contact information into the chat box. So you can contact me either by email or by phone, and I'll be happy to mail this out to you, along if you don't have a printer and you want a copy of the PowerPoint or any of the resource sheets at the end, I'll be happy to mail those out. So just contact me and I can mail those. So this personal healthcare journal is just, when you open it up, there on the very top, it says your local SMP, which is Senior Medicare Patrol. Well, in our booklets, they do have the Texas Senior Medicare Patrol number printed there. And then below that are some helpful phone numbers. Then you write your name, your doctor's name, your clinic that you use, your pharmacist's name, an emergency contact. And so you fill in your personal information. And then down on the first page, it tells you you can record, like when you go to the doctor, which doctor you went to, what day, why you went there. Did you go for a test? Did you go for a follow-up? Did you go for a follow-up? And so this is a way that you can keep account of when you went to the doctor or when you got testing done. That way you can compare that with your Medicare summary notice and make sure that your doctor's visits or your test or procedures match up with what's being charged to your Medicare number, because it's easy to forget. Now, if you go in the hospital, it's a little bit harder because there's going to be a lot of charges on there that you're not going to understand. But just your regular doctor's visits, a lab test, an MRI or a mammogram or something like that, it's important to keep account of that. And so, and if you don't want one of these little journals, you can just make your own journal out of a spiral notebook. And next slide, please. And so also these, and I will say it didn't have a slide on it with a picture of it, but also in this little booklet, it tells you to write down questions that you have when you want to go to the doctor. So let's say you're taking a new medication and you get a headache 30 minutes after you take the medication. You need to tell the doctor that because you might need to look into that. Or if your doctor gives you information during the visit that you need to write down. So maybe you're taking 2 pills for breakfast every morning and that doctor says, okay, we want to try something different. We want you to take 1 pill in the morning and 1 pill at night. So that's something that you would want to write down so you can remember it. This little booklet also allows you to record your medications in there and your blood pressure, your just other pertinent medical information. And then if you go out of town, you might want to take this with you because in case there's an emergency, it has all your medical information here. So you want to take your personal health care journal to appointments, to doctor's appointments. You want to record your questions before the appointment and then write down answers to the questions in this little booklet. And write down any instructions that the doctor might give you that's different from what you normally do. And then you want to use this journal when you're checking your Medicare summary notice to make sure that your doctor's visits match up with what's being charged to Medicare. Next slide, please. So this is the Medicare website. This is their homepage. And if you are computer savvy, it's pretty user-friendly. And up in the right-hand corner, and it's kind of hard to read, it's a little blurry, but it has a little lock sign, and then it says mymedicare.gov login. So if you are on Medicare and you're computer savvy, I highly suggest you starting an account on mymedicare.gov. And so you can click on this little upper right-hand corner, and if you already have a sign-in, you can access your account on mymedicare.gov, or you can sign up for an account on mymedicare.gov. So you'll need to come up with a username and a password, and then it asks you to answer a question. And with this, and next slide, please. With establishing an account on mymedicare.gov, you can look at your summary notices in real time. So when Medicare mails you your Medicare summary notices, they mail it 3 months, 3 months worth. So they mail it to you quarterly. If you have an account on mymedicare.gov, you can look at it in real time. So you don't have to wait 3 months after the fact. You can look and see when Medicare approves or denies a claim, and you can act on it. If they deny it, then you can start researching it. And if you want to appeal it, you can go on and do that. You don't have to wait 3 months until you get your paper Medicare statement in the mail. Now, I will say the Medicare summary notice is for people that are on original Medicare only. If you're on a Medicare Advantage plan, you do get some kind of, I guess, explanation of benefits, but it's going to look a little bit different than what we're going to see here in just a few slides. Also, if you have an account on mymedicare.gov, you can check your Medicare Part B deductible status, so whether you've satisfied the deductible or how much of the deductible that you satisfied. You can view your eligibility information. So if you're on a government program called Extra Help or Low Income Subsidy, it will tell you that you're on that, which program you're on, and I believe it'll tell you if you're on full subsidy or partial subsidy. You can track your available preventative services. So if you're able to get your mammogram or whatever, it'll track that for you when you had your last one and if you're available to get another one again. And then also you can research Medicare health plans or prescription drug plans on mymedicare.gov. All right, next slide, please. Next slide, yeah, okay, there we go. So the Medicare Summary Notice is a tool to help you track your medical information. Remember, this is a summary of medical services that you get every 3 months. It is not a bill, it's just a summary of medical services through Medicare. So it helps you catch errors and potential fraud and abuse. So it's really important that you review your Medicare Summary Notice. It lists the amount providers had billed Medicare for services received. It lists the amount of that Medicare paid the providers for those services. It lists the amount that you might be billed. It lists any non-covered or denied services. And it provides an instruction on how to file an appeal with Medicare if that's what you want to do. Next slide, please. Click it one more time. All right, there we go. So the Medicare Summary Notice, some of the things that you might want to watch for, so you want to look for the same services that were billed on different days, and maybe one was covered and one was not. You want to find out why the other one wasn't. Make sure that any reimbursement check that you might have received from Medicare matches what you're expecting before you cash it. So, and Medicare might send you a reimbursement check. It's not going to happen very often, but an example of that is my sister-in-law. She had a fall and she went to a chiropractor. And he did some adjustments. He said, I'm not sure that Medicare is going to pay for this. So if you'll pay for it up front, I will bill Medicare. So she did, and Medicare approved some of those charges, and therefore Medicare refunded her a check because she had paid up front. She had paid cash up front. So that might be a reason why Medicare might reimburse you. So it should match up, whatever checks they send you should match up with what's on your Medicare statement or your Medicare Summary Notice. And make sure that the services that you received or the supplies that you received are the same on your Medicare Summary Notice. So if you read your Medicare Summary Notice and you notice that you've been charged for a wheelchair or diabetic supplies and you don't have a wheelchair or you're not a diabetic, you need to attend to that immediately. Someone either has made a mistake, and that could be the case, or somebody has stolen your Medicare number and they're charging things to your Medicare number and committing fraud. So you definitely want to have those things removed, because if you needed a wheelchair, if you legitimately needed a wheelchair within the next 5 years, you could not get one because Medicare will only pay for a wheelchair every 5 years. So that's why it's so important to really review your Medicare Summary Notice. And then you also want to watch for duplicate payments of the same service. Okay, next slide, please. So this is a Medicare summary notice. This is back from an example back from 2011, but they're still, they still look like this. They did go in and make them in 2011, they made them just, I don't know if it was in 2011 or 2010, they were easier to read, a little more white space, and things were bolded and just a little bit easier to decipher. So it's going to have your name and your address up at the top left-hand side. And if you'll notice on the right-hand side at the top, it says, "This is not a bill." And then it'll have your Medicare number there on the left. It says notice for your name. It has your Medicare number, and then the date the notice was sent out. And that's real important. If you want to file an appeal, that's the date of this notice, September the 16th, 2011. And then this Medicare summary notice is for claims that were processed from June the 15th to September the 15th for that 3-month period. Then underneath that, you'll see your deductible status. So here it tells you your Part B deductible, you've now met $85 of your $162 deductible for 2011. Then on your right-hand side, it tells you your claims and your cost this period. And so did Medicare approve all your services? And that was a big NO. So that should catch your attention, that you might need to look at that, and might be something that you might need to investigate because you might have to pay that out of your pocket if you don't get that resolved. And then the number of services that were denied, there were 2 services that were denied. And so those services totaled $150.86. And then the providers that made claims during this 3-month period, there's the doctor's names and there's the date of the Medicare claims. Okay, next slide, please. So the next page tells you kind of how to look at the notice and how to read it. And then how to report Medicare fraud. And this says if you determine that there might be fraud, you can call Medicare, or you can call the Texas Senior Medicare Patrol. And then over on the right-hand side at the top, it just tells you about your preventive services. And then your messages from Medicare underneath that, just reminding you about your pneumococcal shot. And then in the next paragraph, this is very important. To report a change of address, call Social Security at 1-800-772-1213. If you move, it is very important that you call Social Security. That's the first thing you need to do. And Social Security will contact Medicare. The reason you need to do this is you might have to change your plan, your Medicare plan, because if you're on a Medicare Advantage plan and you move from one zip code to another, your plan might not be good in that zip code. You might have to choose another plan. It might not be offered in that area. So it's really important for Social Security to have your current address. Also, when they mailed out the new Social Security cards, remember they took your Social Security number off of the Medicare cards, and now the new Medicare numbers are just numbers and letters that are randomly chosen by a computer. So Social Security mailed out those new Medicare cards to the addresses that they had on file for everyone. So some people had not changed their address with Social Security, therefore they didn't get their Medicare card when they should have, their new Medicare card. So a lot of reasons you really need to keep Social Security abreast of your current address. Okay, next slide, please. So then this is page 3 of this Medicare summary notice, and now we're getting into a little more detail. So on June the 18th, you went to Jane Doe, MD, and that should be those X's should be her phone number after her name. And then there's her address. And you got some therapeutic exercise to develop strength, endurance, range of motion, and flexibility each 15 minutes. And there's the Medicare billing code. And were the services approved? Yes, they were. So that provider charged Medicare $45. So Medicare approved $28.54. So just because the provider charged $45 doesn't mean that Medicare is going to pay 80% of that. They have negotiated prices that they will, that's called assign, that they have assigned that particular procedure or service. So Medicare approved $28.54 as a total amount for that service or procedure. And so out of that $28.54, they're going to pay 80%, which is $22.83. And so the maximum you may be billed is $5.71. So that's $28.54 minus the 80%, which is $22.83, and then minus the 80%, I'm sorry, $22.83, and then your 20% could be $5.71. But if you'll look down there at the bottom of the box that says maximum you may be billed, look over to the right-hand side, and there is a capital A. And I don't know if you can see down at the bottom of this page. I don't know, Kristen, I don't know if you can scroll down to where it says notes for claims above. There we go, perfect. Oh, wait a minute, that went to the next page. So maybe you can't scroll down. Maybe this is as far as we can go. But down at the, there we go. Down at the bottom of the page, it has notes where it says notes for claims above. It says your claim was sent to Medicare Supplement Insurance, your Medigap policy. So if you had a Medigap policy, then Medicare is sending that $5.71 to your Medigap policy for them to pay on it. So that means you don't have to act on anything. It means that the claim is going through its normal processes. And so since Medicare approved their part, then your Medigap should take care of the rest of it, depending on which Medigap plan you have. But all of them will have Part B reimbursement. All right, next slide, please. So here are two other claims. So on June the 28th, it looks like you went to an eye doctor, and both those services were approved. And so the doctor charged $143 for a medical exam, an eye exam. Medicare will assign $107.97 as the total that they would pay on that. And so they'll pay 80% of that, which is $86.38. And so you may be billed $21.59. They also did a computerized mapping of your corneal curvature. They didn't charge you anything for that. And so there's a zero there. And so down at the total for the claim, you might be billed $21.59. So see, next to that zero charge, it has a little B next to it. And so if you'll look down to the very bottom, it says notes for claims above. And under B, it says this line is for reporting purposes only. You should not be charged. If there is a fee listed, you do not have to pay. So that's telling you if there is anything written in that little column or that little row, you don't have to pay it. And then down at the very bottom, the total for the claim, $21.59, it has a C. So then you'll look down at the bottom, notes for claims above, and it says C, your claim was sent to your Medicare supplement, Wellmark Blue Cross Blue Shield of North Carolina. So you don't have to pay anything. That's going through the normal process. Medicare is going to send it to your Medigap. So that's great. All right. So then on the 29th and the 30th, looks like you went to a cardiologist, and these are the two services that weren't approved. So you got an electrocardiogram and a destruction of skin growth. So it says service approved? No, on both of those. So the provider charged $55. Medicare did not approve any of it, and Medicare did not pay any of it. So your maximum you may be billed is $55. but it has a D and an E there. So let's look down at the bottom and see what that means. So D means the service was denied. So the information provided does not support the need for this service or item. And then E, it just kind of tells you how or what they used to determine whether they were, going to approve it or deny it. And so this is something that you're going to want to follow up on, or you're going to have to pay this out of your pocket. Now, I would contact the provider first. Maybe the provider used the wrong billing code. That's a possibility. There could be a lot of reasons why Medicare denied it. And so if you can't resolve it, then you might have to pay that $55 and the $68.56, which comes to a total of $123.56. But I would always try to appeal, or I would start with the provider first, see if they put in the right billing code, and if they didn't, then maybe they could put in the correct billing code and rebill it, and that's done quite often. And if that doesn't work, then you might have to appeal it. So the next slide, please. So this is telling you how you can file an appeal if you haven't resolved it by talking to the provider. If you disagree with them denying it, your appeals must be filed within 120 days of that date of notice. And so remember, on the very first page of the Medicare summary notice, it said date of notice, September the 16th. So you have to file it within 120 days. And it gives you right there, January the 14th, 2011 is when you have to have filed your appeal by. Medicare must have received it by that date. And so you just follow these instructions, and it just tells you how to file an appeal. Okay, next slide, please. So if you do detect something on your Medicare summary notice that either is not approved or that you don't recognize, it didn't match up with your, if you logged it in your personal health journal and you don't see that date in there, or you don't think you got that, or you see a wheelchair that's charged to your Medicare number and you don't have a wheelchair, then if you don't have a provider to call, then or if there's a provider on there and you can't get a hold of them, then you probably need to call the Senior Medicare Patrol. You can call Medicare, or you can call the Senior Medicare Patrol. So you want to gather your information and documentation and make sure that you think it is fraud or abuse when you do report it to Medicare or the Senior Medicare Patrol. And the Senior Medicare Patrol is a free and confidential service. So it doesn't cost you anything. And if they determine that it's not fraud or abuse, that's okay. It's better to report it and it not be fraud and abuse than you not report it and it is fraud and abuse. So, all right, next slide, please. So here are some financial fraud scams. This little pamphlet was put out by the Indiana Area Agencies on Aging, and like the top 9 frauds or scams. So durable medical equipment scams. If anybody's trying to sell you something at reduced prices or pressuring you to get something that you feel like you don't need, or or if they call you and they say, we have an arthritis kit and Medicare is going to pay for all of it, we just need your Medicare number. Don't do that. If it's not something prescribed by your doctor or a medical professional, then don't give out your Medicare number, because once they get that number, they can bill all kinds of stuff to your Medicare number and collect on it. Phone spoofing. So scammers can change their caller ID to a number that looks like it's coming from Social Security or IRS. So remember, Social Security or Medicare or IRS are not going to call you unless you already have a phone call arranged with Medicare Advanced Solutions, or you've called Social Security and sometimes their lines are so busy, they say, leave your name and number, we'll call you back. In that situation, yes, Social Security would call you back. The IRS is never going to call you. They're going to send you a letter. So be leery if something comes up on your caller ID and it says it's the police or IRS or Social Security or Medicare. Lottery scam. These scammers send out emails saying you won a foreign lottery, but you have to provide some money up front before you can collect your money. That's a big scam. Phishing emails. They look like an email from your bank or from an institution that you deal with, and it looks very legit. And they say, hey, we're having a problem. We need you to click on this and verify your information. And I just yesterday got an email from my bank, and it said that they had frozen my account and that I needed to click on there and clear it up with them. But it was not from my bank, so I just deleted it. So you have to be real careful and very vigilant. There has been a scam in the past. Number 5, can you hear me? So people will call and then they'll say, can you hear me? And you say, yes. And then they record your voice saying yes. And then they authorize charges, unwanted charges to you just because they recorded you saying yes, and saying that you authorized those charges. Number 6, home repair scams. This is real common in this, if you want to flip back, yeah, real common in this area because we have lots of hailstorms. So you'll have people knocking on your door the day after the hailstorm. Somebody wants to fix your roof. They can do it today. They can do it right now, and they can do it at a discounted price. Don't do it. Don't do it. You contact the people that you want to repair and do your research before you have your roof repaired. Grandparent scams. This is where scammers will take advantage of, grandparents, and someone will call and say that they're the grandchild and they're in trouble and they need money. Don't send money. You need to talk to your family members, or call your grandchild and double check and make sure that that's your grandchild that's needing money. Fake debt collectors. So scammers will call and try to collect payments for overdue accounts when you don't owe anything. IRS is, they use that a lot as a scam and say they're gonna, send the police out after you. You owe an IRS debt. IRS is not gonna call you on the phone. They're gonna send you a letter if you owe them money. Free trial offers. So they get you to sign up for something that's free, but they just need your number to pay for shipping or something like that. And then they sign you up for all kinds of stuff and keep billing your credit card. So you need to be real careful about that also. Okay, next slide, please. So here is the Senior Medicare Patrol number for Texas. It is based down in Houston. This is the hotline number, the 1-888-341-6187. And then there is a national resource number for the Senior Medicare Patrol, and that number is 877-808-2468. And then down at the bottom is a Senior Medicare Patrol resource website. So www.smpresource.org. So this is great information. And again, if you ever have a question or you think it's Medicare fraud, you can call this Texas Senior Medicare Patrol at 1-888-341-6187. And next slide, please. So this is my information. So if you want to contact me, I'm Mary Jane Frank with the Area Agency on Aging. Here is my email address. It's mfrank@nctcog.org. You can call our 1-800 number, or you can call the direct line. You don't have to go through the switchboard. It's 817-695-9166. I'll be happy to mail you any of these PowerPoint or any of the resource sheets that we're going to go over in just a minute, or I can mail you, if you want one of these personal healthcare journals, I'll be happy to mail one to you. As the Area Agency on Aging, there on the right-hand side, those are the 14 counties that we service. So we service the 14 counties that surround Dallas and Tarrant County. Dallas has its own Area Agency on Aging, and Tarrant County has its own Area Agency on Aging. And then we service the 14 counties that surround Dallas and Tarrant County. So we're the Area Agency on Aging, but the program that I just talked about is the Senior Medicare Patrol, and it covers all of the counties in Texas. And so again, up there at the top, the 1-888-341-6187, that is the hotline for the Texas Senior Medicare Patrol. Okay, and if you can unshare this, Kristen, and share the other resource sheets that I provided. Oh, great. Okay. So this is just talking, well, that's fine. We'll start with this one. Talking about a fraud alert with COVID-19. So these scammers use anything to prey on the fear of people to scam them. So we all know there's no FDA approved vaccine for COVID-19. There might be some treatments, but there's no cure. So scammers will use fear tactics to convince people that there's a vaccine or a cure is now being offered. And maybe if you just want to give me your Medicare number, I can, we can mail you the vaccine or the cure or whatever, the medication. Or they might say, we're going to send you a test kit for COVID-19. We just need your Medicare number. No, no, that's not, that is a big scam. So just make sure that you don't give your Medicare number or your Social Security number or personal information out to anybody that, to any unsolicited calls, texts, emails, home visits, booths at health fair, unless you're getting a flu shot. That is legit. A lot of health fairs will give flu shots and they have to ask for your Medicare number. And definitely be suspicious of anybody going door to door to offer free coronavirus or COVID-19 testing supplies or treatment or masks or hand sanitizer. You just don't want to give your Medicare number out to someone like that. And then you also need to carefully review your Medicare summary notice to make sure that there's no errors or claims for products or services that you didn't receive. And this is something that we can send out to you, or if you have a printer, you're going to get all the PDF copies of the PowerPoint and the resource sheets afterwards. Okay, next resource sheet, Kristen. This is a great one, and we won't be able to see all of it because I don't think she can scroll down. But this is Scam Smart. It is a it is a list of phone numbers to report healthcare scams, money transfer scams, report mail, email, online scams. Oh, great, you did, you could. Okay, you can scroll down. Report check fraud scams, report either fundraiser or charitable scams. If somebody, had you donate to something and it was a scam, this is the number that you need to call. And then about the annual credit report. You should at least get one free annual credit report just to kind of check your credit every year to make sure nobody's tried to open up an account on your name or, that you don't have something against your credit report that maybe wasn't your fault. And then on the back side of it is just some helpful phone numbers. And one thing, you want to put your phone number on the do not call list. And so they're on the fourth bullet down. It says do not call list. So you can either do it online on www.donotcall.gov, or you can call them and put your number on the do not call list. And so that keeps salespeople from calling your number. So you also want to examine your wallet. You don't need to carry around your Medicare card, your Social Security card with you everywhere you go. Because again, if somebody gets steals your wallet and gets your ID license and your Social Security number and your Medicare number, they can do a lot of damage. You might want to, if you can scroll down, to that? Okay, there we go. You might want to consider using a password to protect your cell phone if your phone is capable of doing that. Encrypt your home wireless network. Most of ours have to have a password to get on there anyway. That's kind of already in place. Avoid clicking on attachments or links contained in unsolicited emails, and don't respond to unsolicited emails. So remember, that could be a link that could infect your computer. And when you're using your debit card, they suggest that you always use it as credit, because you can have a choice whether you can use your debit card as credit or debit card. Because if you use it at a debit card and someone gets your number, they can clean out your account, all your money that you have in your debit account. But you do have some protection as a credit card. So they can't go in and take your money on a credit card like they can with a debit card. Don't use the same password for all your online accounts. Don't click on any pop-ups on the internet, and limit your information that you make available on social networking websites. Don't let everybody know when you're going out of town or on a trip. That just leaves yourself open to burglary or other things. And then here is how you obtain your annual credit report. Okay, Kristen, next slide, or next resource. So we're getting into close to Medicare open enrollment, October the 15th through December the 7th. And there's a lot of fraud that goes on during that time. So make sure that you're extra vigilant during that time. You don't want anybody to steal your identity or to scam you to get your Medicare number. So be careful. If someone says maybe they want to send you a new ID card, but they need your Medicare number to confirm it. No, that's not the case. They don't need your Medicare number to confirm it. Now, if you're signing up on Medicare's website or on the plan's website for a new plan for next year, you do have to give your Medicare number, but not for some unsolicited call. You don't know who it is. Be very careful with your Medicare number and your Social Security number. One of the scams is that people have called and said, hey, we're going to refund some of your last year's drug plan premium cost, but to get your refund, we have to have your Medicare number or Social Security number. That's a scam. Or maybe someone might try to sign you up for a plan that you don't need, or isn't right for you, or doesn't exist, just to kind of get your money. So, and can you scroll down to the bottom of the page, Kristen? So this is just, again, reminding you, report, detect, protect, detect, and report. And if you have problems, you can call the Senior Medicare Patrol and talk to them about it. And down at the bottom, it says, get help to make the right choice. So for free Medicare counseling, you can call the Texas State Health Insurance Assistance Program, or they also call it SHIP, which is what I am, a SHIP benefits counselor. And you can call 1-800-252-9240, and then they ask you to enter in your zip code, and then that will connect you with the appropriate area agency on aging that handles your county. All right, next resource sheet. Okay, so this was one big fraud that was happening before the pandemic, and I ran into it twice at one health fair in Collin County. So genetic screening and cancer screening. So, and there were two booths at this health fair. And so they were telling seniors, we're going to do a cancer screening, but we need a cheek swab, and we need your Medicare number. And we're going to bill Medicare, and we'll send you the results of the test, and we'll see if you're maybe prone to have cancer. And so that is a scam. Medicare will only pay for DNA or genetic testing in rare circumstances, and they'll only do it if a doctor, it has to be medically necessary for treatment or diagnosis, and it needs to be done in a doctor's office or a medical clinic. So what these scammers were doing, they were getting people at health fairs, they were getting the swabs, getting their Medicare number, and then they had a doctor down in Dallas, and this was just, within the last year or two, they just arrested this doctor. He was signing off fraudulently on all these Medicare claims to have it tested, and they were billing Medicare thousands of dollars just on that one cheek swab. And the people that had the cheek swabs, they never got answers. They never got results of the test. So it was a huge fraud scam, and it was happening here in Dallas. So, okay, and I think that's all of them. I think we've gone over all of the resource sheets. All right. Okay, so remember, if anybody has any questions, or if you need to talk to me, you have my email address and my phone number, and I'll be happy to help you, or anything on the Texas Senior Medicare Patrol or anything about Medicare. Be happy to help you. So thank you today, and thank you for the Plano Library for their technical assistance. I couldn't have done it without you. And do we have any questions?
Thank you so much, Mary Jane, for this great presentation. And I don't see any questions right now in the chat, but any of you who may have a question, you are welcome to type that in to the chat. And I'm putting Mary Jane's, I could not reach the chat while I was doing your slides. Okay. So I'm putting your email address into the chat and also your phone number. So there is one question. What about getting a flu shot? Do you provide a Medicare number for that?
Yes, for getting a flu shot, yes. So that is one service that they do quite often at health fairs, and that is okay. You give them your Medicare number, and they're going to give you something in exchange right then and there. They're going to give you that service of a flu shot. So in that situation, it is okay to give them your Medicare number.
Okay, very good. And they say flu shot at local pharmacy too?
Yes. Pharmacies, okay. Yes, yeah. Pharmacies
okay.
are legit. They're, you have to do that.
Okay. Let's see. We also, just so that those who are attending today know, we are making a recording of this video, and it will be available on the Plano Public Library. We'll be sending it out to you, and then also it will be available on our YouTube channel. So please share the information with others that you know could benefit from this. Any other questions? The only ones I'm seeing are about the flu shot. Okay, I have another question, Mary Jane. So someone is saying, I became eligible for a Medicare supplement in July. How do I know it's legitimate?
So, well, you probably got a card from the supplement. That's something that you probably want to call me about, and we can talk about it. So just call me at 817-695-9166, and we can talk about that offline.
Well, also we have Mary Jane just presented a Medicare 101 session here at the library last month. And that recording is also available, and some of the information about your Medicare benefits. I mean, she did an excellent, very thorough presentation on that day. So anyone who's interested in learning more about Medicare specific could benefit from that recording that is on our YouTube channel as well. Other questions? And I did put Mary Jane's email address and her phone number in the chat. It was also on her last slide. I don't see any other questions coming through. So Mary Jane, thank you so much for your time. You were very thorough and gave excellent information that's helpful for folks. And hopefully our participants will also share this with others that they know who may benefit. And we will have you back again, of course, Mary Jane.
Okay. Thank you.
Thank you so much for your time. The email and the phone number were in the chat, but I'll just repeat it again. If you don't know how to access the chat, there's on the bottom of your screen, if you hover over the bottom of the screen, there's a line that says participants, And then there's something that says chat, and it has a little kind of like a speech bubble over it. And if you click on the chat, you can see all of the questions that have been put in. And this is where the information is Mary Jane's email address, name, and phone number. But I'll repeat that for you. This is Mary Jane Frank. She's a benefits counselor with the Area Agency on Aging. And you can reach Mary Jane at 817-695-9166. And her email address is mfrank, M-F-R-A-N-K, at, this is the North Central Texas Council of Governments. It's a weird thing here, nctcog.org. So I hope that got everyone what they needed. All right, any other questions before we sign off today? We're glad that you were with us today. Thanks so much for your time, and have a wonderful afternoon.